Hi, I'm Hiroya from Funk Physio Physical Therapy. Today I'm going to talk about the tennis elbow, which is also known as lateral epicondylitis or lateral elbow tendinopathy in medical terms. Essentially, tennis elbow is a tendon pathology caused by the overuse of wrist and elbow muscles. I will demonstrate how tennis elbow occurs and also discuss how we treat it. Let's talk about the elbow anatomy related to tennis elbow. Extensor carpi radialis brevis, which I call ECRB, is responsible for 90% of the tennis elbow cases. It attaches to the lateral outer side of the elbow and it crosses over the wrist. So this muscle works for wrist movement. Then people often experience diffuse pain around lateral side of the elbow when the ECRB becomes inflamed or experiences poor recovery. Also, extensor carpi radialis longus, which attach to the upper part of the elbow, and extensor digitorum, which is finger muscles, attach also almost the same spot as ECRB. Those muscles are also responsible for some of the tennis elbow cases. Next, I'm going to talk about lateral elbow tendinitis and tendinopathy. Both of these terms can be called tennis elbow, but they are slightly different in terms of condition of the tendon. I wrote on the blog more in detail, but I will briefly explain the difference between those two terms. First, tendinitis is an inflammatory process of the tendon, which occurs in ECRB muscle. During the inflammatory response, tendon tissue breaks down. As a result, the tendon becomes weak and you feel pain when you use the ECRB muscle. The treatment plan usually focuses on decreasing the inflammation, so you may decrease the activity level or start light strengthening exercises. On the other hand, tendinopathy is no longer in an inflammatory state, so this is a stable condition. But the tendon tissue is still weak. It typically occurs after the tendinitis calms down. In this phase, you need to work on regenerating healthy tissue through strengthening training. I will introduce specific exercises for tendinopathy. For the tennis elbow treatment, eccentric exercise is one of the most effective strategies. Eccentric training means that muscle works when the muscle is stretched. For the ECRB muscle, this muscle is stretched when you bring your wrist down like this. So when you hold the weight and bring it down, this is eccentric exercise because ECRB is working but also stretched. So this motion is eccentric, and the other way is called concentric, which is muscle is working and also shortened. So concentric and eccentric, and you can help with the other hand for concentric motion, then gradually go down for the eccentric motion like this. Yes, then you can do this exercise 3 sets of 10 to 12. Then if you feel easy to do this, you can increase the weight gradually. And also we expect some pain from this kind of exercise because this exercise put stress on the tendon, which is kind of necessary to facilitate tissue reconstruction. But make sure follow up your treatment plan with your physical therapist and gradually increase the stress to the tendon and strengthen the structure. This time I talked about what tennis elbow is and how we treat the tennis elbow. This time I just focused on general elbow treatment, but oftentimes when people have elbow pain, the pain comes from other body parts including shoulder, trunk, hips, or ankle. In part 2, I I discussed importance of whole body movement and specific exercise. So I introduced how other body parts influence on the elbow. For example, if you have tight shoulder and you can't pull back or raise your arm up, your wrist and elbow might compensate for that lack of shoulder mobility. So you may when you have elbow pain, maybe elbow is not the problem, maybe shoulder is a problem, or trunk or hip can cause elbow pain. So please read through the part 2, and if you have any questions, please let us know, and I'm happy to answer and help you. That's it for this part, and thank you for watching, and see you guys later.